Special press conference. I'm Stephen Fishback of the East Way Patrol Division with the Charlotte-Mecklenburg Police Department. And last year, at this very time, I stood down at the Law Enforcement Center and we discussed the topic of fentanyl and how it's affecting every neighborhood across this city, state, and country. It's killing our loved ones, our friends, and our neighbors. That reality has not changed since last year. 137 people in the Charlotte-Mecklenburg region have died from drug overdoses. That is a 20% increase from this time last year. And 60% of those deaths are persons under the age of 40 years. Today is National Fentanyl Prevention and Awareness Day, as observed by the Drug Enforcement Administration. The DEA calls fentanyl the single deadliest drug threat that our nation has ever encountered. I said it last year, and I'm going to say it again this year. Fentanyl will kill you right there where you take it. All it takes is 2 milligrams. 2 milligrams of fentanyl, and that's about what would fit on the tip of my pen. It takes those 2 milligrams to stop a person's heart within minutes. And the scariest part of that is that oftentimes people who are overdosing, ingesting fentanyl, they don't even know that they're taking fentanyl. They don't even know what is in that drug they're taking. That is why we are all here today, to sound the alarm. This stuff is incredibly dangerous and can be hiding in anything. Today, we're joined by our partners here in Charlotte who have seen up close, day in and day out, the impacts of fentanyl on our community. You're going to hear from Mecklenburg County Medic, both our county and federal attorney's offices, a medical expert from Atrium Health, and the medical director for the Mecklenburg County Health Department. Also joining us here in support is Charlotte Fire, the Mecklenburg County Sheriff's Office, Homeland Security, and the Drug Enforcement Administration. But first, to speak more from the perspective of the CMPD is Major Luke Sell of the Special Investigations Bureau. Major?
Good morning. As Captain Fishback stated, my name is Luke Sell. I'm the major over our Special Investigations Bureau. That includes our vice narcotics and our federal task forces. I want to thank all our community partners for being here today. A special note of appreciation for the Drug Enforcement Agency or Administration and Homeland Security Investigations, as they're invaluable resources to our teams. The partnerships are vital in our fight against this distribution of this horrible drug. As most of you know, and as Stephen talked about, fentanyl is a synthetic opioid like morphine and codeine. It's 50 times stronger than heroin, 100 times stronger than morphine. It's prescribed to treat patients with chronic and severe ongoing pain. We're seeing fentanyl on the street as a white or an off-white powder, which is infused into cocaine or heroin most of the times, or made into pills that look like any other prescription pills, which is the most disturbing ways we're seeing it packaged. Counterfeit pills that are hiding lethal doses of fentanyl. We've seized several pill presses used for this very thing. Fentanyl is being disguised and sold to our teens and young users as pills for anxiety or to help concentrate and study, specifically Xanax, Percocet, and Adderall. These users have no idea that their pills were mixed with fentanyl. You can't see, smell, or taste fentanyl. We really want to emphasize that unless it comes from your pharmacy or your doctor, you cannot trust the safety of any pill. This poison does not discriminate. We're seeing overdoses in million-dollar homes. We're seeing them in back alleys of our city and county. So far this year, CMPD's Vice Unit has seized more than 30 kilograms of suspected fentanyl and more than 84,000 suspected fentanyl pills. For context, a kilogram of fentanyl has the potential to kill 500,000 people. What we've seized just this year alone has the potential to kill up to 15 million people. What keeps us up at night is what slipped through or what we've missed. Our Vice unit and our task force detectives spent countless hours to interrupt the supply of fentanyl coming into our city. We're blessed to have some incredibly talented canines and their handlers. Today we have one of those special team members, Callie. Callie's been serving with CMPD since 2018, helping her handler with narcotics investigations. Her nose is a huge asset, and in the photos we're going to push out, you can see the kind of hauls that she's able to uncover. The impacts of fentanyl extend to our patrol and other resources. Our officers and first responders are all too often coming in contact with fentanyl, putting each one of them in a risk of exposure. Through the first half of 2023, CMPD has responded to over 1,000 overdose calls for service. And that's the only calls that we're getting. That doesn't count what CFD and medic are responding to without us. That's a huge drain on our resources, and it pulls our officers away from other priority calls that we could be answering. So far this year, there's been 137 deaths. One of those deaths came last night at 7:30. That's a 32-year-old person who's no longer with us, who doesn't have a tomorrow. Luckily, we're responding and reviving a tremendous amount of overdose subjects. Medic and CFD do a fantastic job. Our patrol divisions are equipped with Narcan, and we're seeing that even they are routinely having to dose individuals. Today, we're excited to have Medic unveil a new OD map system that will be a huge resource for all of us to track real-time overdose death calls for service. Dr. Studnick will talk about that in just a minute. But if you have one thing to take away from today, that would definitely be that no one should ever take a pill that they didn't get from a pharmacy or a doctor. One pill can kill. This drug is destroying families and neighborhoods all over our county. None of us are immune. Many of us already realize the devastating effects of this poison. We're asking, no, we're begging you to help us spread this message. Thank you.
Next up to speak will be Dr. John Studnick, Deputy Director of Mecklenburg County Medic. Doctor.
Thank you all for being here today to talk to us about the very important topic of opioid overdoses and substance abuse within our community. Mecklenburg EMS Agency and the men and women that serve our community play a very important role on the front line of battling the opioid crisis. We treat about 7 patients a day with suspected opioid overdose. 7 patients a day that we suspect. And many more that are in some other mental health crisis or substance abuse crisis. And this work, while we are proud to serve our community as frontline responders, requires a community around us to help reduce the burden of harm on our public because of opioids. And that's why we're very proud to stand up here today with Atrium Health, with our partners at Mecklenburg County Public Health, and the other responders that provide care to our community. Many times you will see that we provide frontline care to our providers by providing Narcan to patients when they have an acute overdose. But something we also do is when we identify patients that may have the potential to overdose in the future, we participate in what we call harm reduction programs, where we hand out boxes of Narcans to families, to friends, to partners, to other caregivers so that they can be frontline responders in case an opioid crisis were to occur. And we hand out about 50 boxes of Narcan a month to folks in the community to help reduce that opioid burden. And that alone is still not enough and requires continued collaboration, which is why we're very happy to announce that we're participating in a OD mapping program where we will be providing data to a federal database that helps understand when and where overdoses occur within our community. That will afford a community response and ability to understand where narcotics are so that we can go to patients before patients may need us, so that we can understand when and where an emergency may occur, so we can be better prepared to respond in the moment and as we plan initiatives within our community to reduce the burden of opioids here in Mecklenburg County. And so really what we see here in front of us today is a response that's very important from healthcare, from government, from those in law enforcement that understand the seriousness of opioid abuse disorder within our community and are prepared to help those who need it overcome this addiction. Thank you for being here today, and thank you for the support of all our community partners.
Next up to speak, joining us from Atrium Health, is Dr. Christine Murphy. She is an expert in emergency medicine and medical toxicology. Doctor?
Good morning. Thank you for having me today. My name is Christine Murphy. I have been involved in emergency medicine and medical toxicology for the last 13 years. And I've been a faculty member with Atrium Health's Department of Emergency Medicine at Carolinas Medical Center and their Division of Toxicology for the last 10 years. I want to thank the community partners that are here today and helping to raise awareness of just how dangerous fentanyl is for our community. Without everyone on this panel and the organizations they represent, their efforts are just amazing and have really helped us to reduce harm in the community. The numbers of victims in our community that would have died from fentanyl would have been much higher without their efforts. Fentanyl is highly addictive and highly potent drug. As has been stated previously, only a small amount is needed to stop somebody from breathing and lead to cardiac arrest. In the emergency department and on our consultation service for toxicology, we see patients in increasing numbers that have been exposed to fentanyl or had accidental overdoses. With the changing landscape of what we're seeing in the fentanyl products patients are using, we also see that many times patients need more doses of naloxone or higher amounts of naloxone to be revived in the field and in the emergency department. Additionally, they may need additional doses of naloxone in the emergency department to keep them breathing. This leads to longer hospital stays. This leads to longer emergency department time because of those resources being needed to keep these patients alive. The impact of this drug, however, extends far beyond those that have opioid use disorder, and I think that's important to recognize. I can't tell you the number of times we've had a patient that's been revived by CMPD or medic that comes into the emergency department and had no idea that they were exposed to fentanyl. That wasn't their intent. They had no intention of using fentanyl or any other opioid. This is a good demonstration of what was noted previously, that fentanyl is pervasive in our community, it's pervasive in the drug supply, and you can't consider any drug bought on the street safe. We are seeing fentanyl contamination in cocaine, in marijuana, and as stated before, we are seeing fentanyl manufactured into pills that look like pharmaceutical grade drugs and then marketed as those drugs, which puts our community at risk. Additionally, our pediatric population is not going unharmed with this epidemic. Not only have we seen an increased number of teenagers that have been using fentanyl as part of their opioid use disorder, we are also seeing and have seen, unfortunately, multiple toddlers suffer cardiac arrest from exposure to fentanyl. These exposures come as they explore their environment and put something in their mouth that either has fentanyl on it or put fentanyl alone in their mouth. I cannot echo the sentiments of those who have spoken before me enough. Fentanyl is extremely dangerous and it is pervasive in our community. You can't predict who is going to use fentanyl. You can't predict what pills you use have fentanyl in them. And you don't know who is going to end up dying from a fentanyl exposure. I think it's also important for members of the public to recognize not only is this an extremely dangerous drug, but also recognize that naloxone in the hands of community members saves lives. This may be the life of a family member, this may be the life of a colleague, this may be the life of your child. Finally, if you or somebody you care about is suffering with substance use disorder, there is hope. There are multiple resources available in our community to help. It can be frustrating at times to navigate those resources, but I think a great starting place is your local health department, your physician's office, or Atrium Health has a behavioral health line that is accessible 24/7, and that number is 704-444-2400. Thank you.
Our next speaker will be Dr. Bonnie Coyle of the Mecklenburg County Health Department. She is the medical director. Doctor?
Good morning, everyone. It's a real privilege to be here today representing Mecklenburg County Public Health and joining with our community partners to address such an important topic. You know, when I first started training in medicine over 30 years ago, it was unusual to see an overdose in the emergency room. Maybe we'd see one every couple of weeks. But now, as you heard Dr. Studnick refer, we're seeing 7 a day here in our community. This has become a problem that is impacting so many of our family members and community members, and really need a comprehensive approach in order to start to have an impact. And if you're going to address the opioid epidemic, you need to really be focusing on prevention, harm reduction, and then linkage to care. The opioid settlement dollars is going to be bringing $72 million over the next 18 years to Mecklenburg County to build strong programs to make sure we're having an impact. Mecklenburg County Public Health is really excited to be a part of that, to contribute funding to community members, community agencies, to be able to create even more strong programs than what we already have. In the area of prevention right now, Mecklenburg County Public Health has case management programs to work with pregnant women and young children dealing with the traumas that might eventually later cause them to engage with substance use. And those are important evidence-based prevention programs to help individuals. We're also very active in the harm reduction area, working with syringe service programs, with Medic, and other community agencies to distribute naloxone kits throughout our community so that family members who have a loved one who might have a substance use disorder problem has naloxone available in the event of a tragedy. We're really looking forward to using additional dollars from this settlement to expand that program even further. And then we need to focus on linkage to care and bringing evidence-based medical treatment programs for people who are already suffering from substance use disorder here in our communities. Again, going to be having a large amount of funding available to expand those programs so that anyone who has a problem can get access to the needed services so that they can get better. So again, this is such an important topic we need to be focused on, and working together we can start to improve the situation. Thank you.
Next, we have the District Attorney for Mecklenburg County, Spencer Merriweather.
Good morning. My introduction to the prosecution of drug crimes, and specifically fentanyl, was not in a trial court. It was in a recovery court. It was in that courtroom that you see people whose entire lives have been ravaged by the type of addictive and dangerous drugs like fentanyl. But it's not just those folks. It's their families. When they see that how lucky they were to escape death and how lucky they were to be on the road to recovery, that you see just the awful impact of a drug like fentanyl. So for those that would say that drug crimes or the crime of fentanyl is a victimless crime, one day in our recovery courts in Mecklenburg County will relieve you of that idea. One day of hearing about 7 people who have overdosed and had to go to an emergency department will relieve you of that idea. One day of seeing people who have been preyed upon thinking that they are smoking a joint and realizing that they are having their first taste of lethal poison will relieve you of that idea that this is a victimless crime. One day of understanding that someone who thinks that they are in pursuit of the greatest high that they've ever heard of doesn't realize that in a moment they're tasting something that can kill them. One day of realizing that in your own community, these things are being brought by the ounce and the pound, by foot, by car, and even in our airports. You realize that we are all victims to what's going on with fentanyl. It is the reason why my office is dedicated to prioritizing the prosecution of fentanyl trafficking. It's the reason why we stand shoulder to shoulder with the partners behind me to make sure that we are confronting this head on, and why we will be here every single day to make sure that people in Mecklenburg County are not continuing to be victimized by fentanyl. Thank you for being here, and I thank all my partners for being here as well.
Next, we have the U.S. Attorney for the Western District of North Carolina, Dina King.
Good morning. I'm Dina King, the United States Attorney for the Western District of North Carolina. On this day, I want to express my deepest sympathy to all the families and friends who've lost loved ones to a drug overdose. I know nothing can ease the pain you've suffered, but I want to offer my condolences. I also want to offer a message of strength and encouragement to those who are currently battling with substance use and addiction. We've convened this morning in our shared mission to confront the fentanyl epidemic and to protect our communities from its deadly grip. This highly lethal substance has the power to destroy lives, relationships, and communities. It's causing great harm in our communities, and it's taken a toll on the lives of people of all ethnic, racial, and socio-economic backgrounds. From our cities to our small towns, from our schools to our homes, and from young to old, no one is immune from this deadly drug. Even the smallest amount can be lethal, and that has led to substantial and tragic loss of life. The statistics that you've heard earlier this morning are jarring, but they do not entirely capture the devastation and the loss that so many families carry every day as a result of this epidemic. The stakes are high and human lives are in danger. I speak on behalf of the Justice Department and my office when I say that fentanyl is now a top threat to the health and safety of our communities, and protecting our citizens from this potentially lethal substance is more critical now than ever before. But to eliminate this grave threat and to address this public health crisis head on, we have to tackle the supply chain at every level. From stopping the importation of fentanyl chemical precursors to identifying and dismantling fentanyl trafficking networks, to holding accountable those who endanger our local communities, our success requires a coordinated and unified response at all levels of government. As federal prosecutors, we work tirelessly with our law enforcement counterparts to end fentanyl trafficking and to save lives. That includes conducting multi-jurisdictional and multi-agency investigations to uncover trafficking networks and prosecute bulk fentanyl traffickers like Jermaine Grandy, who earlier this month was sentenced to 35 years in federal prison for trafficking fentanyl and illegal gun possession. You see, Grandy's source of supply was in Arizona. Grandy would travel frequently to Arizona, where he would buy fentanyl pills in bulk. Those pills he then brought back to Western North Carolina for local distribution. A joint investigation spanning across state lines led to the arrest of Grandy, where he was driving back from Arizona with almost 35,000 fentanyl pills, which were destined for distribution in our streets, to our neighbors, and to our children. Another joint investigation with federal and local law enforcement led to the prosecution of Gary Lee Davis, a Charlotte man who just last month was sentenced to more than 15 years in federal prison for trafficking fentanyl and cocaine. Davis was a major fentanyl distributor, and he admitted to trafficking between 50 and 100 kilograms of fentanyl right here in Charlotte. To put this in perspective, 1 kilogram of fentanyl has the potential to kill 500,000 people. The quantities Davis was trafficking was enough to kill every single person in our city and beyond. I share these examples to highlight our coordinated law enforcement efforts focused on putting an end to the fentanyl crisis and eradicating this dangerous drug from our communities. But in addition to prosecuting both distributors and drug networks, we're also bringing to justice fentanyl dealers responsible for drug overdoses and overdose deaths. Dealers like Megan Tate, who was sentenced to 20 years in federal prison for distributing fentanyl to 2 incarcerated females, causing them to overdose. As a result, both women, those victims, needed to be hospitalized, and one was placed on a ventilator. Thankfully, they both survived the overdose. And dealers like Victoria Irby, who was sentenced to 15 years in federal prison for dealing fentanyl that resulted in a young man's overdose death. What's particularly troubling about Irby is that she continued to deal fentanyl, this lethal substance, knowing it was causing customers to overdose. At Irby's sentencing hearing, the victim's mother addressed the court and spoke about the pain and the devastation of losing her son to fentanyl. She also talked about her son's ongoing efforts to recover from addiction and how his death ended the family's hope that their son would ever win the fight against addiction. For this reason, in addition to our enforcement efforts, the Justice Department is also committed to supporting communities with this public health crisis and the challenges of substance use and abuse. Last year, the Justice Department announced the disbursement of federal grants to support drug prevention and treatment programs. Among the grant recipients were counties here in the Western District of North Carolina to fund new and existing drug treatment and diversion programs. This coming year, the Attorney General announced that the department is expected to make available funding to support programs that focus on recovery and treatment for people who are struggling with addiction and substance abuse. The Justice Department's grant-making components also continue to support local law enforcement by providing important assistance to our partner agencies. In this coming year, the Attorney General expects over $224 million to be distributed to local police departments. These funds will support additional hiring for officers, technical assistance to support drug investigations, and to identify and develop practices used to interrupt drug trafficking at all levels. Preventing the loss of life and protecting our communities from the fentanyl crisis requires an enormous amount of work. But I want to assure the community that all of us here today are committed to that work. We have the focus, the persistence, and the tenacity to be successful and to triumph in this fight. It's my pledge to all the families who have been affected by the fentanyl epidemic that we will continue to do all we can with all we have to use every investigative and prosecutorial authority we have to bring to justice those who spread this poison in our communities without respect for our nation's laws and with little regard for human life. We stand united with our partner agencies, and I look forward to our continued work in the days ahead. Thank you.
Thank you to all of our speakers being here with us today. Today's press conference is a continuation of shedding that crucial spotlight on the urgent need for fentanyl awareness. This collaborative effort is to increase awareness, education, and let people know the access they have to resources in our community. These are proactive steps towards preventing further loss of lives in our community. Let us all commit to working together to address this issue and provide support to those in need in our community. At this time, to our media partners, we are going to open it up for questions. If you would please, just give us your name, your outlet, and which speaker you are addressing. With the question, please speak loudly, as it is a little more difficult than normal to hear in here. So at this time, I'm going to open up the questions. Again, let's keep those questions specific to the topic of fentanyl awareness. Yes, Callie Cox of the Observer.
Well, it's coming in from everywhere. So like one of the speakers talked about, it's coming in via automobiles. It's coming in, we're seeing a lot at the airport. We're seeing a lot through the mail and people just bringing it in their packages as they're traveling back and forth around the country. I think it's an awareness campaign that we all need to be a part of, and we'll of course take part of that, and I think you have that assurance from everyone up here that we'll do our best to kind of educate, but I think we all have to take a piece of that. It's happening in every one of our neighborhoods, so I think it's vitally important that we are inside those high schools educating those, but I'm sure our school resource officers or our SROs will be in there doing some of that education this year. I would have to get you those numbers because I don't want to speak to something I don't know exact numbers for.
Any other questions for me? Additional questions for our other speakers? Callie with the Observer, Atrium Health.
Sure. In terms of what we're seeing among high schoolers and teenagers, a lot of times we're seeing them come into the department similar to other overdoses, unresponsive, having received naloxone. Some of these patients knew that they were using fentanyl and have an opioid use disorder. Some of these patients did not know they were using fentanyl, thought they were using another drug, and unfortunately had an event or life-threatening event because of that. I think it's been more of a gradual uptick, and I don't have those numbers in front of me specifically, but it's been more of a gradual. I think having the conversations is really important, and even if you do not feel your child is using drugs and putting themselves at risk, they may have a friend that is using drugs, or they may be at a party where drugs are being used, and I think it is important to have the conversations and empower your teen or empower your children. Give them a naloxone kit. Talk to them not only about the dangers, but how they can save a life, because that impact on them long term is going to be profound if they watch one of their friends die. And maybe that kit could be used on them if there's an accident, if they thought they were using marijuana and really it was containing fentanyl. So I think that is a huge thing, and something that you can do when you're sending your teen off to college, when you have a teen even locally in school here, because we see it throughout the community, all races, all age, all socioeconomic statuses. So it's usually 1 to 2 doses depending on the type of naloxone you have. And most of the naloxone being given out in the community right now tends to be intranasal, so it's a spray up the nose, which makes it very user-friendly, and you don't have to have medical skills to be able to give that.
Other questions for the doctor? Thank you,
Thank you.
Doctor. Questions for our other speakers? Thank you everyone for joining us. To our media partners, please refer to that release that the public affairs team sent out to you. I know we put a lot of information out this morning. A lot of that data and statistics will be in that release. Thank you.